Welcome to Learn with Professor Janula. In this session, we are going to learn about uterine fibroids, also known as leiomyoma. If you find this video helpful, please like, subscribe, and share it with others. Don't forget to click the bell icon to stay updated with our latest videos. Uterine fibroids are growths that develop from the smooth muscle of the uterus. They are benign, which means they are not cancerous. These fibroids are very common in women, especially during the reproductive age group. Many women may have fibroids without even knowing it, because they do not always cause symptoms. The presence, size, and location of fibroids decide whether a woman experiences problems or remains symptom-free. As nurses and healthcare professionals, it is important to understand that uterine fibroids are a common condition, and early awareness helps in proper management and reassurance of patients. Now let us talk about the incidence of uterine fibroids in a simple way. Uterine fibroids are actually the most common benign pelvic tumor seen in women. This means that among all non-cancerous growths in the pelvic region, fibroids are the ones we encounter most frequently in clinical practice. They are seen more commonly in women between the age group of 30 to 45 years, which is the active reproductive period. One important point to remember is that fibroids are estrogen dependent. This means they tend to grow when estrogen levels are high, such as during the reproductive years, and they often shrink after menopause when estrogen levels decrease. This explains why fibroids are rare before puberty and usually reduce in size after menopause. Now let us understand the types of uterine fibroids in a simple classroom-style manner. First, submucosal fibroids. These fibroids are located just beneath the endometrium, which is the inner lining of the uterus. Because they lie close to the uterine cavity, they commonly cause heavy and prolonged menstrual bleeding and are often responsible for anemia and fertility problems. Next, intramural fibroids. These are found within the myometrium, the muscular wall of the uterus. This is the most common type of fibroid. As they grow, they cause the uterus to become enlarged and bulky, and women may complain of a feeling of heaviness or lower abdominal discomfort. Now, subserosal fibroids. These fibroids grow beneath the outer covering of the uterus called the serosa. Since they grow outward, they usually do not cause much menstrual bleeding. Instead, they produce pressure symptoms, such as frequent urination due to pressure on the bladder or constipation due to pressure on the rectum. Lastly, pedunculated fibroids. These fibroids are attached to the uterus by a stalk. Because of this stalk, there is a risk of torsion, which means twisting of the fibroid. Torsion can cut off blood supply and cause sudden severe abdominal pain, making it a surgical emergency. Understanding the type of fibroid helps us predict the symptoms and plan appropriate management. Now let us look at this diagram to understand the types of uterine fibroids more clearly. You can see intramural fibroids located within the muscular wall of the uterus. These are the most common type, and they cause the uterus to become enlarged and bulky. Next, notice the submucosal fibroids. These grow just beneath the endometrial lining and project into the uterine cavity. Because of their location, they are the main cause of heavy menstrual bleeding and infertility. Here you can also see subserosal fibroids on the outer surface of the uterus. These fibroids grow outward and usually cause pressure symptoms, such as frequent urination or constipation, rather than menstrual problems. Finally, observe the pedunculated fibroids. These are attached to the uterus by a narrow stalk. Pedunculated fibroids may be submucosal or subserosal, and they carry a risk of torsion. Torsion can lead to sudden severe pain and requires immediate medical attention. This diagram helps us visually understand how the location of a fibroid directly influences the symptoms experienced by the patient. Now let us discuss the risk factors for uterine fibroids in a simple and friendly classroom manner. First, estrogen stimulation. As we already learned, Fibroids are estrogen dependent. When a woman is exposed to estrogen for a prolonged period or in excessive amounts, it stimulates the uterine muscle cells and increases the chance of fibroid formation. Next is family history. If a woman has a close relative, such as a mother or sister, who has uterine fibroids, her risk of developing fibroids is higher. This shows that genetics also play an important role. Another important factor is early menarche. When menstruation starts at a younger age, the body is exposed to estrogen for a longer period over a lifetime. This prolonged exposure increases the risk of developing fibroids later in life. Lastly, obesity. Excess body fat increases estrogen production in the body. Higher estrogen levels can stimulate the growth of fibroids, which is why obese women have a higher risk compared to women with normal body weight. So these risk factors mainly work by increasing estrogen exposure, which encourages fibroid growth. Now let us discuss the clinical features of uterine fibroids. One of the most common symptoms is menorrhagia. This means abnormally heavy or prolonged menstrual bleeding. Women may complain of soaking pads frequently or bleeding for many days, and over time, this can lead to anemia. Another symptom is dysmenorrhea, which refers to painful menstruation. The pain occurs because fibroids interfere with the normal contraction of the uterus during periods. Infertility is also an important clinical feature. Fibroids, especially those near the uterine cavity, can interfere with implantation or block the fallopian tubes, making it difficult for a woman to become pregnant. Many women also experience pelvic pain or a feeling of pressure. This may present as a heaviness or discomfort in the lower abdomen or pelvic region, and the pain may increase during menstruation. Finally, fibroids can press on nearby organs. Pressure on the bladder can cause frequent urination, while pressure on the rectum can lead to constipation. So the symptoms of uterine fibroids mainly depend on their size, number, and location. Now let us understand how uterine fibroids are diagnosed, step by step. The first step is pelvic examination. During this examination, the doctor physically examines the pelvic organs to assess the size, shape, and position of the uterus. In women with fibroids, the uterus may feel enlarged, irregular, or firm on examination. Next is ultrasound, also called USG. This is the most commonly used investigation for diagnosing uterine fibroids. Ultrasound helps us clearly visualize the uterus, ovaries, and surrounding pelvic structures, and it can identify the presence, size, number, and location of fibroids. In some cases, MRI may be advised. MRI is not routinely done for all patients, but it is useful when the diagnosis is unclear or when detailed assessment is required before planning surgery. It gives a more accurate picture of complex or multiple fibroids. Finally, hemoglobin level is checked through a blood test. This is done to assess anemia, especially in women who have heavy or prolonged menstrual bleeding. Low hemoglobin levels indicate blood loss over time due to menorrhagia. So, diagnosis of uterine fibroids involves clinical examination, imaging studies, and blood tests to assess associated complications. Now let us discuss the management of uterine fibroids in a simple and practical classroom approach. First is hormonal therapy, especially GnRH analogs. These medications work by reducing estrogen levels in the body. As estrogen levels decrease, the fibroids tend to shrink in size and menstrual bleeding is reduced. This therapy is often used for short-term management or before surgery. Next, NSAIDs are given for pain relief. These non-steroidal anti-inflammatory drugs help reduce menstrual pain and inflammation. They do not shrink the fibroids, but they are very useful in improving the patient's comfort. Another important part of management is iron supplementation. Many women with fibroids suffer from heavy menstrual bleeding, which can lead to anemia. Iron supplements help treat and prevent anemia and improve hemoglobin levels. So, medical management mainly focuses on controlling symptoms like pain and bleeding, reducing fibroid size, and correcting anemia. Now let us discuss the management of uterine fibroids in a simple and practical classroom approach. First is hormonal therapy, especially GnRH analogs. These medications work by reducing estrogen levels in the body. As estrogen levels decrease, the fibroids tend to shrink in size and menstrual bleeding is reduced. This therapy is often used for short-term management or before surgery. Next, NSAIDs are given for pain relief. These non-steroidal anti-inflammatory drugs help reduce menstrual pain and inflammation. They do not shrink the fibroids, but they are very useful in improving the patient's comfort. Another important part of management is iron supplementation. Many women with fibroids suffer from heavy menstrual bleeding, which can lead to anemia. Iron supplements help treat and prevent anemia and improve hemoglobin levels. So, medical management mainly focuses on controlling symptoms like pain and bleeding, reducing fibroid size, and correcting anemia. Now let us discuss the nursing management of a patient with uterine fibroids in a simple and practical classroom way. The first responsibility of the nurse is to monitor bleeding and vital signs. This helps in identifying excessive blood loss early and in assessing the patient's overall condition. Next, the nurse should assess for anemia. This includes observing for signs like pallor, fatigue, and dizziness, and reviewing hemoglobin reports, especially in women with heavy menstrual bleeding. Pain management is another important role. The nurse should assess the severity of pain, administer prescribed analgesics, and provide comfort measures to help reduce discomfort. Preoperative and postoperative care is essential for patients undergoing surgical treatment. Before surgery, the nurse prepares the patient physically and psychologically. After surgery, the nurse monitors for complications, maintains wound care, and promotes early recovery. Finally, emotional support is very important. Many women feel anxious about symptoms, fertility issues, or surgery. Providing reassurance, listening to concerns, and offering psychological support helps the patient cope better with the condition. So, effective nursing management focuses on physical care as well as emotional well-being of the patient. Thank you for watching and learning with Professor Janula. I hope this session helped you understand uterine fibroids clearly and confidently. If you found this video useful, please like, subscribe, and share it with your friends and classmates. Do leave your comments below, and don't forget to click the bell icon to get notified about upcoming nursing and medical education videos. Happy learning, and see you in the next class.